Turning now to the latest on COVID-19 in Canada and a grim assessment of the situation in Ontario. The head of the province's scientific advisory table estimates Ontario is now seeing more than 100,000 new cases per day. John Northcott has more on this story for us this morning. Good morning, John. Good to see you. It's certainly become, water cooler chat again lately, hasn't it? As more and more people know someone who now has COVID.
Good morning, Jennifer. Yes, indeed. Estimates are that some 5 million Ontarians since December have perhaps contracted COVID. And if the number of 100,000 plus cases every day bear out due to the wastewater testing that they've been able to do, that's about 5% of the population that at any given time has COVID and is dealing with COVID. So the wastewater is the metric that's using in the absence of widespread public testing. We've seen a large removal of masks through members of the public, and there are those like Dr. Peter Uni of the Science Advisory Table who warns that perhaps the wrong message is being sent, and that rather than having it more like a switch that gets turned off and on, it should be a more gradual removal of the public health restrictions. Let's listen to Dr. Peter Uni.
What we're seeing right now is that the viral RNA in the wastewater is at around the level that we saw when the Omicron wave first peaked. And at that time, we had roughly 100 to 120,000 infections per day. That's our estimate based on wastewater. And we're at the same level again as we were then. Of course, we're in a different position. So I agree we shouldn't panic, but we should mask up. That's the point here.
So the not panic line, in fact, comes from the health minister herself, who says it is not a situation that should involve panic. Not downplaying the situation, according to the Premier, Doug Ford. Certain arguably political element to this, with an election due in just about 2 months in the province of Ontario. The public health officer for the province has not given a request for an interview or made a public appearance or any statement in some 4 weeks. And a lot of the members of the media are asking, where is he in all of this for guidance? What is being watched for next as those numbers continue to climb, up 30 to 40%? Hospitalizations, a lagging indicator in all of this. Once again, let's listen to Dr. Peter Uni.
If we continue to go up and up and up, we could see again the same sort of hospital occupancy potentially that we saw before. One additional point, which is also important, we see that also internationally, ICUs will be less affected. Again, luckily, it's more the wards that could be a challenge again. And also, excess deaths again, we would like to keep that as low as possible.
Watching that very closely, though, many doctors saying that those who have been taking off masks, the province characterizing it as a personal choice, many of those people should, in fact, be wearing them for the protection of themselves and so many others. Jennifer?
Not just in Canada, John. We're seeing a spring surge of cases internationally. What more are you seeing on that?
Yeah, and a variety of reactions to that. We'll begin in Germany, where they're considering having mandatory vaccines for those over the age of 60. They were thinking of something perhaps more dramatic than that, but it's become political. Members of the coalition on the far right want to do away with mandatory vaccines of any kind, and in fact do away with many of the, and if not all, the public health restrictions that they're seeing in Germany. India watching the situation very carefully. Their numbers down considerably, but they're watching the XE variant, first detected in the UK. They have their first case of the XE variant in India right now, but they're reporting that the individual is not seriously ill, but still watching that very carefully in that country, because like each subsequent variation on this we seem to see, it is more transmissible. And finally, we're going to tell you about Shanghai, a situation where the city remains in lockdown. They were to open up part of the city, but that isn't going to happen. Numbers continuing to rise there, relatively low compared to even what we're seeing in the province of Ontario. But for a country that has a COVID-0 policy and has had people in Shanghai locked down for weeks as part of that, people saying they are short of food, they are short of emergency supplies, and they are getting angry and upset at what's happening there in China. Watching all of the situation for you. COVID right around the world. Jennifer?
John, thank you for this.
Okay.